Welcome to my presentation on medical student learning. So essentially what we have been looking at is presenting tutorials to medical students, both some in the room and some through Microsoft Teams, and the investigation is to see whether there's any difference in their recall in those two contexts. So just diving in with a bit of background. So obviously we had the pandemic, COVID-19, and that changed how we needed to work and how we needed to deliver our education. And as we all know, we've moved a lot more to online and remote learning and using technology for learning, which is all well and good. And I know the curriculum is changing to do a lot more blended learning. But the question as medical educators is really, is that working? And is it resulting in the same level of learning for our students? And that's the basis behind doing all of this research. If we think about the learner and how the learner learns, we can think of it as an interface between the content that they're trying to learn, the facilitator, so the individual delivering the content, or even the e-learning package, the instructions on that, and then the environment in which the student learns, the community that they're in, the physical environment that they're in, and the general ethos of the course. So there is an interplay between all of these, which feeds into the actual learning that the learner experiences. And this is adaptive from situativity theory. The question really is, if we remove that individual from the environment and stick them at the other end of a computer screen, do we cause some disconnect there between these factors? And do we affect their learning? So the aim of the study was to try and evaluate differences between face-to-face and online. And as I said, in the context of delivering a tutorial to see where students are learning better. Then the question is, how can we do that? So if we're delivering a tutorial, how do we find out who's been engaging better with it? So we looked into recall, and I just want to illustrate something from another study called the mnemonic similarity task. So what Stark et al. Did was they showed images to individuals, and then they showed them a series of images afterwards, and they were asked to say whether or not they'd seen that image before. And obviously, looking at these images here, the top image is the exact image, so if someone was to say, yes, I've seen that before, they'd be exactly right. The bottom image, a pair of spectacles, is completely different. So they would be wrong in saying that they'd seen it before. But then we have this middle ground where there is another picnic basket. Although it's not identical, you would arguably be right to say, yes, I saw a picnic basket before. And that's where we have this distinction between detailed recall, as in getting all of the details right, and gist recall, which is more of an understanding to say, I've seen a picnic basket, I understand that. And particularly when we're looking at things like education, medical education, a gist understanding is often quite relevant, a basic understanding of the concepts rather than exactly what the diagram or phrase looked like. So as an example of some of the components we've used in our questionnaires at the end of these tutorials for students, they may have seen a slide that said something about atherosclerosis and had a diagram on it. And this is a diagram here of the layers of the arterial wall. When it actually comes to their questionnaire, they will see something like this, showing 4 very similar diagrams with very subtle nuances between them, coming down to whether it's capitalized or non-capitalized text. And will be asked to say which they've seen before, which seems very challenging, but there's actually been a substantial body of research showing that the human brain's ability to differentiate images it's seen before is quite astonishing. And in the research we've done so far, students are getting these kind of questions right. So we have these visual questions, but then we also have auditory questions, or we have more gist-based questions, and a whole spread of them for these questionnaires at the end. So what we did was, what we're currently doing is we would run a tutorial where half of our students are in the room and half are looking via Microsoft Teams. We'll run a whole 45 minute tutorial, and they'll have a questionnaire with items like we've just seen before. And then the question is, who did better? As an isolated element, that might seem like enough, but we thought about the fact that each student would have only experienced one context, and it wouldn't necessarily be clear if they had just a individual preference for one or the other. So we very early adopted a 2-session design where we would swap the context for each student. So if one had done face-to-face, they would swap the teams for the next one, and then compare those performances to analyze for any errors. We can rule out things like practice effect as well to try and get our outcome, hopefully giving us some indication of one being better than the other, perhaps. So just some points to know. We're still in the middle of collecting this data. I've got one more tutorial to give, and then we'll have all the raw data. But this is a real world study. So for example, if a student joins on Teams at 8 o'clock in the morning and then they go back to sleep, they'll score very poorly in their questionnaire. So that does affect our results, but I think it is also quite reflective of how people might behave in real life. So it does have value, and that's all going to need to be discussed in the discussion of this study. Social distancing has been a big limitation in terms of getting enough students in the room to make any changes that we see significant. So what we actually had to do was run this study twice. So we had one cohort of students who've had both sessions, and I'm now running through a second cohort of students where we've repeated that all. So there's issues with whether they've spoken to each other about what they're being tested on. Then, if we do find something here and we find some outcome to say one or the other context is superior, all we can really say is for third-year medical students at the University of Nottingham on placement at Kingsmill doing my tutorials online was superior or whatever. So we have to think about how we can translate that to a wider educational context. And then, of course, what the implications are. If we find particular superiority for example, face-to-face versus online, when we've moved so much to online, what does that mean about the way we deliver our learning? These are all things that I'm going to need to discuss at some point. And I just put this on at the end, just in case anyone was interested while we were talking about that. Essentially, our hypothesis has been that we believe face-to-face may be superior, but we just have to see what the outcomes of the data collection are. So I'm sorry I don't have any results at this point.